My name is Michelle Johnson. I'm the managing attorney at the Tennessee Justice Center. I represent low-income families to access health care. So moms of kids with special health care needs, mothers that have chronic illnesses or life-threatening illnesses, and try to help them when they hit roadblocks access health care. The cases are heartbreaking in that if I lose, it's not about money or about property. It's about, many times it's about life or death. Yeah, so the most recent story that is on my heart is a mom of a terminally ill child. Her child was born, she thought healthy, at about 18 months old. She started regressing, and she's now 8 and has lost the ability to do most everything. And she is in East Tennessee. The stress of dealing with a child who is terminally ill is hard enough, but she has to face fighting insurance companies every day, and that has literally almost, the stress of it has almost killed her. And we asked this summer if she would tell her story in federal court, and she had never really been out of her small town other than to go take her child to the doctor. She came with her sister, who's a teacher, and she was so nervous she couldn't eat for a day and a half. She'd never been on an elevator before, and I was so worried. And actually, the night before, she's like, "I'm not sure if I can do this." And I said, "You know, you don't have to do it. You don't have to do it, but only you can tell your story." And so she marched into this federal courthouse with opposing counsel, very powerful opposing counsel, and a judge, sitting way high on a bench, as a 20-year-old woman who had lived 80 years. And she walked in like a warrior, and she told her story, and there was not one eye in the courtroom that was dry at the end of it. And when she walked out, she looked like she was 10 feet taller. She was so proud. And that's what we do, is we help people find their own voice so that we can make the system more humane, because they believe we can make the system more humane. And they give us hope that they can.
I am a registered nurse, and my background is in quality improvement. The most rewarding aspect of my job is when I can sit back and see that I have impacted a patient's care in some way, whether it be a small, minute detail or a large scale, such as holding their hand as they take their last breath. While working at the VA, one of the things that I wanted to accomplish was to be able to protect patients' access for creation of a permanent access for renal replacement therapy. And I had a vision of placing a bracelet, an armband on everyone's arms, just to alert the caregivers that we're protecting this access or this vein for future access. I drew it on a napkin that morning, and around 4 years later, I was able to take that to a national level and to promote it, a Save Your Vein bracelet. And it's just a Lance Armstrong plastic bracelet that patients with kidney disease can put on to alert the caregivers to not use that arm or that access because it is for dialysis. One of my missions in life is to be able to just spread the awareness of kidney disease and how we can slow the progression and educate our patients.
My name is Dawn Rudolph. I serve as president and CEO of St. Thomas Hospital. The challenges that hospital administrators face typically include, it's a balancing act at times. It's ensuring that we have the right resources at the right place at the right time, so that we can meet all the expectations of the excellent service and quality that we want to provide, as well as our stewardship to the organization. I think most people would say that healthcare is challenging, but I'd like to challenge them back to say it's the most rewarding job you could ever have.
My name is Laura Lawson. I am a breast surgeon at Baptist Hospital, which is part of St. Thomas Health Services. I've been here at Baptist for about 8 years now, and I'm a breast surgical oncologist, which means I specialize in breast cancer treatment, although I do see women that have benign disease as well. Well, right now in the U.S., about 1 of every 8 women will be diagnosed with breast cancer at some point during their lifetime. Most women, we find that they're early cancers, they're stage 1, and the survival at 10 years for an early stage breast cancer is in the mid-90s. So the vast majority of women are doing fine. And even with more advanced stages, still the vast majority of women still tend to do fine for long periods of time. So it's really not the death sentence that I think a lot of women have in their mind. But women are very gracious and wonderful, and you realize they have a lot of courage under fire.
I'm Susan Earl Hosback, and I'm the Executive Director of the Minnie Pearl Cancer Foundation. Well, this year is Minnie Pearl's 100th birthday, and we are doing a number of things to celebrate that. Additionally, it's also our 25th anniversary. Minnie Pearl is our legacy. She was an incredible icon here from the Nashville community and was a cancer survivor. Almost on a daily basis, I get calls from colleagues and friends and people that mean a lot to me and to the organization that are being impacted by cancer. And it just again reminds me of how important my job is and how important the Minnie Pearl Cancer Foundation is to this community and to the larger community.
My name is Michelle Covington, and I'm the Director of Children's Community-Based Services for Centerstone. It's a big title, but what it means in reality is that I direct the folks that go out in the field and work in the homes and in the communities with the children in our areas. You know, I think one of the things that I wish folks realized across the board is when they think of children and family receiving mental health services, we still unfortunately have a stigma attached to that. It's those people or it's those services. And I really wish we could get to the point where mental health is seen just like your child has their yearly physical or they have their yearly dental checkup. You need to touch base with your child every year about how they're doing with their mental health. What's going on? What's different at school? Are there bullying issues that they did have before? Who are their friends? What's going on? I think we need to get past some of the stigma that's attached to it and start looking at how we develop whole and healthy kids. And I think that's one of the things I've been really blessed with is that I've got a staff that really shares that mission and are really about developing whole families and understand that you can't work with a child without working with their whole family, or you fixed it for the moment, it's not fixed long term.
Kelly Miller with Craft Healthcare Consulting. I'm a senior consultant here, and our predominant work is based around third-party reimbursement. Basically, we help our clients understand how and why they get paid. Healthcare is so different, especially Part A and hospitals. It's so different in an accounting basis in a revenue world than any other industry. Accountants are typically classified as very nerdy, introspective people. And it's very hard to be that way in this industry, in the consulting business. In fact, you're judged, not judged necessarily, but your client base in a large way depends not only on your outcomes, but on your interactions with your clients. So outcomes, of course, first. But it always makes it a little easier for them to pick up the phone if they have a need, if they feel comfortable talking with you. So.
I'm Nancy Brown. I'm the chair of the Department of Medicine at Vanderbilt School of Medicine. This is a time of great transition in medicine in this country. We need to take better care of patients for less money, and doing that at Vanderbilt allows us to apply our creativity and our bioinformatics and systems to improve patient care. So we're in a position to innovate and really impact on health. One of the things I'm really looking forward to is helping the community get to know what we do here a little bit better. We're so fortunate to be in Nashville. It's a big benefit for us as we recruit people. We have a fabulous support from the community, and I really hope to get out and share what we're doing a little bit more with others.
Hello, my name is Janet Sutherland, and I am currently the Dean of the School of Dentistry at Meharry Medical College. Well, we have coming up 125 years of dentistry at the Meharry School of Dentistry. We have a celebration planned from October 12th through the 14th. I think some of the successes we've had so far is that we've been able to increase our class size. We will have a brand new simulation center this week opening. We have some renovation projects that are underway and will be in progress very shortly. Our entering class this year will be 60 students. The students are mostly from minority and underserved backgrounds. They are from all over the country, and they come to Meharry because of our mission to serve and to give back to those populations and individuals who are least served and most vulnerable in our nation.
I'm the Executive Director of Tennessee Donor Services and DCI Donor Services. In the state of Tennessee, with the population that we serve, we have about 1.7 million people signed up on the Tennessee Donor Registry, which is great. We have 2,500 folks waiting in the state of Tennessee for some type of organ transplant. And our program, Tennessee Donor Services, which serves 84 of the 95 counties in Tennessee, had almost 250 organ donations and well above 2,000 tissue donations. So very successful year, but always more to do. People are still dying on the waiting list. So as long as that's happening, we have a big job to do. I guess one of the most significant experiences that I've had in my role with Tennessee Donor Services is on September 11th. We actually had a donation occurring that day at Vanderbilt Hospital, and by the time it was the time to remove the liver and send it to a patient that was waiting in Houston, the planes were grounded. So the most impactful thing that I ever was directly involved in was calling the FAA that morning and saying, I have an emergency and I need your help. And a supervisor in the tower at Nashville Airport helped me that day, and we were able to get that little baby liver on a C-130, and Tennessee Air National Guardsmen took it to Houston, and that little girl is alive today because of all the help and the teamwork that we were able to create around that donation happening. It never ceases to amaze me, the selflessness that people are able to show in the most tragic moment of their life to give the gift of life to someone else.